is it even possible to build muscle during pregnancy? Hormonal shifts during pregnancy can affect the body's ability to develop lean mass and strength. So let's look at some of the hormonal changes during pregnancy and how they affect muscle growth and strength. So first, relaxin. Relaxin is a hormone that increases early in your first trimester, peaking around the 12th week, and then it decreases to 50% of peak levels until approximately weeks 17 to 24, and then stabilizes for the remainder of pregnancy. The reason that relaxin is important when it comes to strength training is that relaxin can decrease your joint stability and may increase your injury risk. I'm going to talk about this when it comes to exercise selection. Next, we have estrogen. So how is estrogen changing during pregnancy? Estrogen dramatically increases throughout the pregnancy and peaks in the third trimester. Then we have progesterone. Progesterone peaks in the third trimester. We have IGF-1, which is a hormone that's responsible for growth and development. This is actually suppressed in early pregnancy, but peaks in the third trimester. This may be an optimal time for women to strength train, as in really the whole pregnancy, but especially even in third trimester, to enhance skeletal hypertrophy because IGF-1 induces protein synthesis and blocks muscle atrophy. And then finally, we have testosterone. Testosterone increases throughout pregnancy, becoming significantly greater than non-pregnancy levels by weeks 13 to 16, and it reaches a peak by delivery. Testosterone increases muscle mass and strength. It can induce hypertrophy in type 1 and type 2 fibers. So that's an overview of how your hormones are affected during pregnancy. What does this mean when it comes to strength training and muscle development? The hormonal environment during pregnancy, especially in the third trimester, may be a favorable setting for muscle adaptations due to elevated testosterone and IGF-1 levels. However, due to an increase in hormone relaxin, it's especially important for women to choose exercises with minimal joint stress during pregnancy. This is where exercise selection comes in, which I'll talk about in more detail in a moment. What's even more cool is that in mouse studies, one paper suggested that pregnancy can improve the regeneration process in muscles and counteract negative effects of aging. So people think that building muscle during pregnancy isn't possible and isn't safe. And although we don't have definitive studies one way or the other to say that it's possible, theoretically and anecdotally from myself and others who have done Evlo prenatal, pregnancy can be a great time to increase muscle and strength.